Hey guys, this is Will, nursing educator inside Coursera. Today's topic, we're going to talk about the best nursing school study tips that were shared by educators over the years, and we believe these are the best tips that any nursing student can do when they get started with nursing school. Now, before we dive right into this topic here, we're going to get this done in 5 minutes, and then you can use these immediately. Make sure you guys download our free note template. Our pathophysiology concept map is extremely popular, and it's completely free on our website. You can find the link down below. All right, so let's get right into it. Number one is figuring out how to create a study plan. Now, you guys, the number one thing you should do first before every nursing class is to organize a schedule and create a study plan for every single nursing exam. So the best tip we usually share with our students is number one, download the syllabus if you have it right away and find out what your test dates are. First step with that is mark the exam dates and then create a study plan for each one of those exams. This allows you to create a visual of when your exams are, and you can create a strategic plan for each one of these exams. After you identify those exam dates and write down on the calendar, this is the best way to visualize when you should study. Now, you guys are going to want to write this down. This is one of the best ways to study and segment your studying out. First is note taking, then it's note reviewing, and then it's practice questions upon what you understand, and then it's active recall, and then we do practice exams. You guys are going to write those steps down, and this is a way you should create a study schedule for every single exam. And number two might be controversial with your nursing instructors, but this is true, guys. They're going to throw so much content at you at nursing school, it's impossible to really read word for word inside your textbook, and you're really not going to retain all the information you read anyways. So what I usually say is do not read every word. So best strategy, we can go straight to number three. Take notes and study before your lectures. Guys, this is one of the most important hacks for nursing school. If you guys stay ahead of the game, the more ahead of the game you are, the better prepared you're going to be for every single exam. You never want to fall behind in nursing school because it goes with or without you. So if you take your notes before your lectures, you're treating your lectures like a review instead of an introduction. You may have heard from your nursing school peers from classes ahead of you that a lot of times you're going to have to teach yourself because nursing instructors truly don't have the number of time to really teach you every single concept. And you really don't want to rely on a nursing instructor to really help you understand the concept because it's really up to you to learn the content. So going back to how you segment your study plan out is note taking and note reviewing should be done before your lecture. So when you have a set plan of notes done, you go into lecture, treat it like a review, and then now here's your opportunity to condense the notes even further because you can now study the lecture instead of just studying the content. Because when you go into the lecture and not actually really understanding the content first, you're playing catch up already. So you want to go into the lecture really fully understanding the content, and then you want to condense that information down. Use your lectures wisely. Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. Now, number four, guys, is very important as well. Double down on your learning style. You do not want to neglect this, especially if this is your first class you're going into for nursing school. A lot of times that's the fundamentals of nursing class. You're going to learn that studying for nursing school is completely different than how you ever studied before, but there's one thing that needs to stay the same. You need to double down on your learning style. If you don't know your learning style already, go to Google and type in and search for tests that will help you find your learning style. But for example, I'm a visual learner, so I use flashcards a lot, and that really helps me do a lot of active recall, which we talked about in one of the study segments. You need to do active recall. Flashcards was my way, as I'm a visual learner, that was my way of doing active recall. So just like everything else in the world, you need to double down on your skill set. Your skill set is your learning style for nursing school. And then number five, guys, standardize your notes. How we talked about earlier, how we need to be organized. We need to be organized with our study plan. Well, you also need to be organized with how you take notes. So once again, we have our pathophysiology concept map on our website for completely free. Well, this is a way you standardize every disease that you go over for every exam. You really standardize how you take the notes so that way you can best retain that information. And once again, it has to double down on your learning style. So believe me, guys, they're going to throw lots and lots of content at you. If you guys can find a way to standardize your notes and create a strategic study plan for every exam, you are going to do just fine. And then lastly, this is really important as well. These are all ways you can understand the concepts they throw at you. So that way it's your actual knowledge, right? Well, in nursing school, here's the extra little kicker. Nursing school, it's not just knowledge. You can know every single thing, and you could still do poorly on the exam because a lot of times the nursing schools like to mimic what the NCLEX does. And of course, the NCLEX is giving you lots and lots of complex nursing scenarios to test your knowledge. So nursing schools, you're going to see this the same thing. So there's a huge skill involved of outside just knowing the content. You can know everything about the exam, But if you don't know how to apply that knowledge into one of these nursing scenario questions, it's going to be really difficult for you. When I was in fundamentals of nursing, I found that out in the hard way. I wasn't failing, but I wasn't doing as good as I should have been because I was studying a lot, because I didn't take the time to take 2 to 3 practice exams. This is extremely important, guys. This is also why we segment our studying times out with practice questions right after you learn a content, because you're immediately applying what you learned. But afterwards, you want to really mimic exactly how your exam is going to be. So if you have an exam that's 50 questions coming up, you want to take 2 to 3 practice exams that are 50 questions and you don't want to be interrupted. This is a way to really help you prepare the best way possible for every single nursing exam. All right, so quick recap. We do this in every one of our videos. We're going to explain everything we just went over in less than 1 minute. So number 1, how to create a study plan. You want to create a study plan, find out the exam dates from your syllabus, download it, create an actual calendar so you can visually see your exam dates, create a strategic study plan for every one of those exams, segment your studying by note-taking, note reviewing, practice questions, active recall, and practice exams. Number 2, do not read your textbook word for word. Instead, find the objectives of each chapter that your instructor assigned and answer those objectives with the concepts inside your textbook. So that way you're able to really condense down the information you really need to understand. And then number 3, guys, this is probably the most important one, I would say. Take notes and study before your lectures. Treat lectures like a review instead of an introduction. Number 4, double down on your learning style. Do not neglect this, please. Number 5, standardize your notes. You need to make a systematic approach to how you retain the information that's being thrown at you as well. One note template that you absolutely need for nursing school is a pathophysiology concept map, which we have for free on our website if you go down in the description below. And then lastly, guys, take 2 to 3 practice exams exactly how your exam is going to be. If it's 50 questions, make sure you do 2 to 3 practice exams that are 50 questions uninterrupted. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.